A new device developed by Duke researchers could help prevent hearing loss in children.
It's called the Mobile Health Tympanometer. The team believes it can identify kids in need of ear and hearing care, especially in areas where access to a specialist is limited. This is an early generation prototype of the mobile tympanometer device developed by Duke researchers. It's a tool used for evaluating infection-related hearing loss. The hope is it could be used to identify children in need of care in rural populations where medical access is limited.
To actually deliver a technology that lets a population get screening that currently just can't at all.
Current tympanometers are available but are not commonly included in screening programs due to cost and the need for an audiologist. Mark Palmieri is an engineer on the project. He says the idea to develop an affordable and accessible version of the device came from Duke Global Health professor Susan Emmett and audiologist Samantha Robler, whose work identified a gap in screening tools.
Their vision was to take what highly trained individuals and more expensive equipment can do and actually have lay people be able to have a device that they could use in the school setting potentially and use some sort of a machine learning type algorithm to acquire data, process it, and then determine if kids are at risk for potentially losing their hearing due to a preventable cause.
The World Health Organization finds about 60% of hearing loss in children can be avoided through prevention measures. Palmieri says the long-term goal is to make improvements on a public health level and reduce hearing loss rates in children.
We know that children who experience eventual hearing loss are just not as productive members of society and can't have a high quality of life. And so our ability to potentially make an improvement in that space is what we really prioritize.
And the team expects to have the device ready to hand off for testing in volunteers by the end of this year, and they aim to start incorporating it in clinical trials by next year. So hopefully help a lot of people.
Yeah, let's hope so.